So if I gave you, or if you gave your patients or your clients the choice of either having stiff muscles or having loose muscles, which would you choose? Hopefully, if you're a healthcare provider, physical therapist, chiropractor, ATC, OT, whatever, you understand that you want stiffness, not looseness. Now, the lay population would probably say, well, I want to be loose because that feels better, I have more range of motion, I'm more flexible. So in this video, we're going to talk about why flexibility is dangerous and you should never be flexible, why it's more important to be stiff or have muscles that are stiff to cause joint stiffness, which is not tightness. We'll talk about the difference between tightness and stiffness, and what that looks like on a gross sense with patients moving, and what that looks like on a neuromuscular sense of what we mean by stiffness. So first, let's take a look at Cole. I'm going to have him do a squat without load, and then I'm going to give him load and see what that feels like. But before we do that, let's first define what muscle is. So if I do this all the time with my patients, especially the patients that say they want to be flexible, or they're a hypermobile patient like a dancer or a gymnast or a swimmer, and they stretch and they foam roll and do all the garbage that causes the problems that they're coming in to see me with. So first, define what muscle is. When I ask patients that they usually come up with something like, well, it flexes, it contracts, it moves you, it controls your movement. So I say, okay, so let's see if you agree with me here. If we give a quick definition of what muscle is a contractile tissue, and its function is to contract and either cause motion at a joint or contract and control motion at a joint. So my bicep is contracting, it's stopping my elbow from moving, so it's controlling motion, or it's causing motion by contracting concentrically, eccentrically. And I'll say, so does that make sense? Muscle is a contractile tissue that either contracts to cause motion or control motion, and they'll say, yep, sounds good. And I'll say, okay, so why do you want flexibility? Or why are you stretching? Why are you massaging? Why are you theragunning? And they'll say, well, you know, the muscle is tight and I want it to relax. And I'll say, whoa, wait a second. You just told me that muscle is a contractile tissue that has to contract to do its job. And now you're telling me that it's a relaxile tissue. So you got to choose. It's either a contractile tissue or it's a relaxile tissue. Which one is it? And they'll say, well, it needs to relax so it causes motion. I'll say, whoop, let's break that down. On a neuromuscular physiology level, which is what you should understand as a medical professional, as my bicep contracts, it causes a reciprocal inhibition response to my tricep to contract less. So if my bicep contracts 5 pounds, my tricep contracts less 5 pounds, so now I have stability at my joint. If my bicep contracted 5 pounds and my tricep turned off and relaxed, now I would not have congruency at my elbow and I would start to develop elbow problems. All right, so muscle is a contractile tissue that either contracts to control motion, cause motion, period. That is it. Muscle, when it is functioning correctly, never relaxes. It either contracts more or it contracts less. So how can we make muscle function at its optimum amount? So we have Cole, who does personal training, does knees over toes, and does weighted squats. So if we have Cole do a body weight squat and come back up and do another one, looks pretty good. Would you say that's easy?
Relatively easy.
Okay.
Yeah.
Now if we give Cole a 25-pound weight and we have him do a squat, is that easier with resistance?
Weight adds to it, but it's easier for me to balance myself.
Okay, so it's easier for him to get down, and you'll see this with your patients. If you have patients that have pain with body weight squats and you give them 20 to 25 pounds and have them do a goblet squat and the pain goes away, why does that happen? Because muscle is lazy. It's only going to contract as much as you make it contract. It's only going to be functioning as long as you make it function. So when he does body weight squat and he's used to resisted squats, he's not facilitating all the muscles that he normally facilitates because his body's lazy. If we make him facilitate more muscles by adding some resistance, it becomes easier for him to get down. If he had knee pain, his knee pain would go away, and he would get more dorsiflexion, knees over toes, not falling backwards, all of those things. So the more you force muscles to contract or facilitate, the more they will, and the better your mechanics get. Now, if Cole never squatted weight, let's say he's a sedentary 65-year-old, this might not work too well for him because he's not used to having more resistance. So if you gave them resistance and they have more knee pain, that tells you that's not their problem. Their problem is pure facilitation. So we have to go through and break them down and find out where they're at on a neuromuscular physiology level. So let's talk about what happens when muscles are stiff versus when muscles are loose. So if I stretch Cole out, let's say he said that he felt tight, he had tight hamstrings, he had tight hip flexors. If I stretch him out and then have him get up and move around, he might say, yeah, that feels better because I just forced muscles to relax. So I now think that they're a relaxile tissue, which they are not. So you can increase range of motion by forcing muscles to relax. 100% agree, research will tell you that all day long. Stretching, foam rolling, massage, Theragun, myofascial release, whatever, will increase range of motion. My question for you, if you believe in that junk, is what are you sacrificing to get more range of motion? So if you've seen our videos, we've done the test strength, stretch, retest strength, foam roll, retest strength, Theragun, retest strength. Strength decreases, force output on dynamometer measurements decreases by somewhere between 20 and 40% after doing those things. So you just increased range of motion by muscles relaxing, being relaxile, and causing flexibility. So let's define flexibility. Flexibility is range of motion for the sake of range of motion with no strength or control factored into the range of motion. So getting as much range of motion as you possibly can, not worrying about whether you have control of that range of motion. Now think of your flexible or your hypermobile patients as they get older. How much chronic pain do they have? How much joint breakdown do they have? Why do they have that? Because they were flexible for so long, they just screwed up their joints. So now let's talk about stiffness versus looseness. So I have a band here. Here's your muscle. It's loose. Okay? Now, if you're somebody who believes in stretching, foam rolling, all that stuff, and you like hypermobility, this is what the muscle looks like. Is that muscle neuromuscularly able to do its job and function on a normal level? So if we have Cole just do a single leg squat, and his vastus lateralis is supposed to control that, and this is slack, what's going to pull him back out? Not his vastus lateralis because it's not facilitated, there's no tension on it. So on a neuromuscular level, he's inhibited, which means he cannot control that muscle function because it's loose. If that muscle was stiff, it would be extremely reactive because it would lengthen as he goes down and it would shorten as he comes up. So here is a loose, flexible muscle. Would you rather have that stabilize your joint, and we can go through a full range of motion, or if I double this up and I make this band stiff, well, before I do that, here's how much reactivity I have here. Not much, okay? Would you like to jump with that muscle? Would you like to run with that muscle? Would you like to try to get out of a bad position slipping on the ice with that muscle? Or would you rather have a muscle that when you asked it to contract and unload, did that? That is a stiff muscle. That is a functioning muscle. So I can still go through a full range of motion, so we never sacrifice range of motion. We still have a full range of motion, but now we explode. Because when we eccentrically load it, it loads under tension. So when it concentrically explodes, it explodes. So if you're massaging, stretching, foam rolling to get bigger range of motion, you're causing slack and no stiffness. You're getting flexibility, which is dysfunctional. If you are facilitating muscles and then training them, here's the important thing, training them through a full range of motion, neurologically you will maintain that range of motion. So you will have a full range of motion with normal strength and reactivity and explosiveness and stability at the joint. So what you should be training for is motion plus strength plus stability, which is what we call MoStreBility, because all of those three components are mutually important. So motion, strength, stability, MoStreBility is what you should be shooting for. Flexibility is what you should be getting rid of, because remember, muscle is a contractile tissue that either contracts to control motion or cause motion. And if you are loose and flexible, you don't have that. So that's where your breakdown, your dysfunction comes, and that's why your patients and your clients are getting worse when you give them exercise, because if you had them stretch and foam roll and do all of the flexibility stuff beforehand, you caused inhibition, which then when you try to exercise an inhibited muscle, you have to compensate. So all you did was cause inhibition and then force compensation, which causes them to break down. If you would have facilitated muscle function, then trained through a full range of motion, you would have a full range of motion and normal muscle function.